Dr. Soto.
Hey guys, how are you?
Good. Me and Sarah are here, and we just had a few questions for you about the Brazilian butt lift.
Oh sure, yeah.
First of all, what is a Brazilian butt lift?
Well, the Brazilian butt lift is a cute name for a procedure that we do where we transfer fat from areas of your body where you might not be so happy to have them to your buttocks to improve the shape and or the size of the buttocks. So it doesn't necessarily mean that you're getting a lift or an augmentation of the buttocks. Really the goal of the procedure is to completely reshape the body, not just the buttocks. So it really, improves all areas of the body, the torso, the back, and the buttocks, so that you look better, hopefully, from all angles.
Can you do the fat transfer to your breast area?
Well, let me give you a little bit of history. Plastic surgeons have been doing fat grafting, which is the process I described where you remove fat from one part of the body and put it in another area. We've been doing that successfully and safely for 30 years. It really isn't anything new or revolutionary. Now we've been doing it for buttock enhancement for probably about 10 to 15 years with excellent success. To answer your question, can it be done to improve the size or shape of a woman's breast? Yes, I think it can be done. I think the bigger question is, should it be done and is it in your best interest? And those are bigger questions that I'm not sure we have answers to yet. And the reason I'm not comfortable personally doing that on any patients who come to my office yet is because the fact is that whether we like it or not, in the United States, all women have a 1 in 8 chance of developing breast cancer. I don't mind putting fat into the buttocks because the truth is that there aren't a lot of women getting cancer of the butt. But cancer of the breast is a big problem. And I would not ever want to be the reason that somebody had a hard time diagnosing or treating a breast cancer. And the unfortunate reality is that when we put fat into a woman's breast, sometimes the fat that we put in there or the scar tissue that results from that operation can be very confusing and look a lot like a breast cancer when you have a mammogram. So it's really uncomfortable for me to think that I might do something to help a woman feel better about the way she looks, and then 20 years from now have her being worried about breast cancer because of what I did. It just doesn't make sense to me right now. I'm hoping that over the next 10 years or so we have enough research to prove that it's either safe or not safe and we have some answers. But right now I don't think we have the answers to those questions, and I think that doing that procedure right now is just a little bit irresponsible.
Is this a permanent procedure?
Fat grafting can be permanent. If the technique is done properly so that the fat has good blood supply after you graft it in its new location, the improvement usually is permanent.
And how much can you graft at one time?
You can graft a fair amount. The largest amount that I've ever put in somebody is about 600 cc's of fat per buttock cheek. Really the determinants of what you should put in are how much fat the patient has available and how much of an augmentation or enhancement you're trying to achieve. So most patients need and get much less than that, but you can put a fair amount in if somebody's really interested in a much larger volume.
Would I need a second procedure, like maybe a tummy tuck after the Brazilian?
Occasionally women do need a second operation if they've had children and their skin and or their abdominal muscles have been relaxed a little bit by those pregnancies. So it's not uncommon to do a Brazilian butt lift on a patient and then come back maybe a month later to do a tummy tuck and maximize their appearance. The majority of my patients who have not had children do not ever need anything but the Brazilian butt lift, and they look fantastic.
Can you combine anything with a Brazilian butt lift, like maybe a breast augmentation?
Well, the answer to your question about whether or not you can do something is different than the answer to the question of whether or not it might be in the patient's best interest. I think that there are lots of surgeons who do often combine Brazilian butt lift surgery with other procedures. I personally believe it's not an operation that I would recommend combining with a tummy tuck or breast surgery, because to do the Brazilian butt lift I have to lie you on top of your abdomen. And if I've just done surgery on your breast, I'm not going to want to do that. And the converse is also true. If I've just operated on your bottom and given you a beautiful round butt, I don't want to lie you on your butt to do your breast surgery. So it's usually better to do the butt separate and then come back a few weeks later and do the abdomen.
Okay. Well, thank you, Dr. Soto, for answering our questions, and we will see you next time.
Okay, great. Thanks, girls.